Gestational diabetes is a condition that can occur during pregnancy. It affects how your body processes sugar. Many women are tested for this condition during their pregnancies. But can you be misdiagnosed with gestational diabetes? The answer is yes. Misdiagnosis can happen for several reasons. First, the tests used to diagnose gestational diabetes are not perfect. The most common test is called the glucose tolerance test. This test measures how your body responds to sugar. If your blood sugar levels are higher than normal, you may be diagnosed with gestational diabetes. However, there are factors that can affect the results of this test. For example, if you did not eat properly before the test, it could lead to an inaccurate reading. Stress and illness can also impact your blood sugar levels. These factors may cause you to receive a false positive result. Additionally, the criteria for diagnosing gestational diabetes can vary. Different health organizations may have different guidelines. Some may use stricter thresholds for blood sugar levels. Others may be more lenient. This can lead to inconsistencies in diagnoses between different doctors or clinics. Another reason for misdiagnosis is the timing of the test. The glucose tolerance test is usually done between the 24th and 28th weeks of pregnancy. If you were tested earlier or later, it may not accurately reflect your body's ability to process sugar during pregnancy. It is also important to consider that some women may have insulin resistance without actually having gestational diabetes. This means their bodies are not using insulin effectively. They may be diagnosed with gestational diabetes when in fact their condition is not severe enough to warrant that label. If you have concerns about your diagnosis, it is crucial to speak with your healthcare provider. They can help clarify your test results and determine if further testing is needed. You can also request a second opinion from another healthcare professional. Monitoring your blood sugar levels can also provide valuable information. Keeping track of your diet and lifestyle can help you understand how your body responds to different foods. This information can be helpful if you feel uncertain about your diagnosis. It is important to remember that gestational diabetes can have serious implications for both you and your baby. It can lead to complications during pregnancy and delivery. Therefore, if you are diagnosed, it is essential to follow the recommended guidelines for managing your condition. Regular checkups and monitoring are key. These steps can help ensure that you and your baby remain healthy. If you feel you have been misdiagnosed, do not hesitate to advocate for yourself. Ask questions and seek clarity about your diagnosis. Being informed about your health is your right. Remember, you are your best advocate. In conclusion, while misdiagnosis of gestational diabetes is possible, understanding the testing process can help. If you have doubts about your diagnosis, discussing them with your healthcare provider is a wise step. They can guide you through the next steps and help you feel more confident in your health journey. Thanks for watching the video. Like and subscribe to get all future updates from us.